There's a lot of different factors go into cost of a dental implant. Whether you have enough bone and it's a simple one implant situation, we simply numb patient, drill a hole for an implant, place the implant. We make the procedure really simple. We don't need a bone graft. We don't need any extra time or scanning, and the implant is simple. And that's the unusual occasion. Oftentimes we're replacing a tooth immediately, so we'll take the tooth out. We'll put the implant in immediately afterward. In that case, it's a little bit more surgical. We put a graft in there, aware where the sinus is at. We have to make sure that we don't hit any nerves. So in those cases, especially our 3D planning is essential to what's going on, to making sure that there's enough bone, that the placement is absolutely perfect and correct. It's not a fly-by-night see your pants thing. It has to be perfect. It has to be precise. For instance, if you have 5 millimeters of bone and you have to place it exactly in the center, you can't just guess. You can't say, oh, we're just going to place it in there. Everything has to be exact. Everything has to be planned out, and that's what we do. We look at the 3D imaging. We go step by step. We take our time. And then it comes back to the foundation too. If the foundation of their bone and their placement is not possible, I mean, sometimes you have to do sinus lifts and bone grafts and other surgeries outside of just, we're just going to place an implant. So it just takes a lot more time, a lot more planning, a lot more cost is involved in doing that because of the outside time and planning, because especially when we're getting 4 implants to line up and we're going to depend on those 4 implants to hold the entire arch of teeth. They have to be exact. They have to have plenty of bone. There can be no mistakes. The best way to get the optimal results is for you to come in, spend some time, let us assess everything with a free consultation and find out what's best for you. And we can individualize your plan, individualize exactly what the cost is going to be. So there's no question at the end that you're going to be taken care of in the way you want to be taken care of, in the budget that you want to work in.